Because I get this question a lot from patients, I thought I would do a presentation just to clear up any confusion or misunderstanding. So here we go. Is the crack noise necessary for adjusting joints? The role of the joint mobilizations when adjusting joints. For decades, we have been under the impression that the noise or pop was necessary for a chiropractic adjustment to work. But is that truly the case? We know adjustments can be extremely beneficial and helpful, but there are some concerns for patients around the force of crack type adjustments. Are there alternatives? Let's first discuss what the noise is. Kachuk et al. In 2015 did a study on real-time visualization on joint cavitation. Now remember, the joint crack was technically known and is known as a joint cavitation. They presented direct evidence from real-time magnetic resonant imaging that the mechanism of joint cracking is related to cavity formation rather than bubble collapse. Their observations are consistent with tribonucleation, a term that describes the process which causes a joint to generate a cracking sound and occurs when sufficient distraction force, so pulling apart, overcomes the viscous attraction or adhesive forces between opposing joint surfaces. So that is like if somebody cracks a knuckle and they like to pull on the finger, what happens is the joint surfaces pull apart and then this tribonucleation occurs. So what occurs is a rapid separation of the joint articulation with the resulting drop in synovial pressure, allowing dissolved gas to come out of solution to form a cavity within the joint. I have been performing C1 adjustments for nearly a decade, and of course, among other joints in the body, but in the form of a joint mobilization, say versus a thrust. So a joint mobilization is much more gentle and much more about impulses. So this is also how I teach gentle manual C1 adjusting on my online platform at courses.clinicalupgrade.ca. This clinical experience came with excellent results, if not better than any alternative with greater intensity or force that I had done in the past. So what happened was the patient's symptoms are resolved with full resolution of neurological impairment because that's how I measure it. So we achieved the desired outcome with patient comfort and a low risk without the crack or noise. So does a joint mobilization work since there is no noise in the form of a pop or crack at the joint with these treatments? Well, the answer is yes. The adjustment can work without the noise. I see this clinical result daily. This is where we talk about the intention of the treatment. I'm a big advocate for intention. So using the C1, for example, I adjust the upper cervical spine with the goal of restoring the C1 vertebra alignment. The intention here is to reduce neurological interference and improve symptoms, including pain, headaches, nausea, dizziness, and vertigo, among other symptoms that can be related to upper cervical dysfunction. So if I eliminate pain and restore neurological health, why would the maneuver or what I do require a noise? It doesn't. I have never required a crack noise from the upper cervical spine in C1 mobilizations and corrections in over a decade. Using gentle techniques are often best in the upper cervical area, even the full cervical spine lower than the upper cervical, lower than the C1. So mobilizations are ideal when treating the C1, in my opinion. Usually what we term a grade 3 or 4 mobilization. And when we look at these grades, it is just based on the 5 grades of mobilization in the what they call the Maitland concept. It's just the structure. Okay, where what we would term as a grade 5 is a full adjustment or a full high velocity, low amplitude adjustment. Okay, so doing these mobilizations, these lower force adjustments, this allows less risk with comparable or even equal benefit, because we must also consider patient comfort and their experience. Ultimately, it removes barriers and permits care for everybody. Sometimes fears play into it. And why would we allow these fears to stop them from getting care that they need to eliminate pain, have a better quality of life? So I feel like by choosing these and not being persuaded by a noise allows people to get the care they receive. So this is just a visual of the different types of mobilizations. So let's look at the literature. A 2022 systematic review by Moorman et al. Concluded that while there is still no consensus among chiropractors on the association of an audible pop and pain outcomes in spinal manipulative therapy, knowledge about the audible pop has advanced. This review suggests that the presence or absence of an audible pop may not be important regarding pain outcomes with spinal manipulation. According to Dr. Sean Thistle, a leading authority on the literature for chiropractic profession, in his course, The Science of the Chiropractic Adjustment, Have We Cracked the Code? He summarized that most studies demonstrate both high velocity, low amplitude spinal manipulative therapy and mobilizations are effective for spine pain. So now we review the question, isn't the pop or crack necessary for success of treating a joint? So in summary, we can conclude that the answer is no. It is completely possible to achieve the same therapeutic results when correcting joint alignment without the noise, based on the literature, based on clinical experience. The cavitation, tribonucleation, or pop and crack, however we term it, it may feel satisfying for the patient and can be a measure of success for the practitioner, but as we can see, it does not dictate the end result. So if you are getting adjustments or providing them and the noise doesn't occur, that doesn't dictate that outcome. It is about restoring health to the area. For me, most importantly, that neurological function. And if we restore that function, then we didn't need the noise, because sometimes by getting the noise, there may be more compromise. Thanks for joining today, and I hope you learned something new.